Good evening, everyone. Today we are back with one more topic, that is your radiation safety and protection in dental radiography. So it's a very small topic, but there are few good questions that come out of it. तो आज हम बेसिक्स से लेकर एंड तक जो भी रेडिएशन सेफ्टी एंड प्रोटेक्शन में है वो सारी चीजें कवर करेंगे. ओके, सो द फर्स्ट थिंग that is very important from exam point of view as well as radiation safety and protection में जो सबसे important चीज है वो है Alara, ALARA. So as you can see here, ALARA, as low as reasonably achievable, as low as reasonably achievable. So what does Alara states कि कितने कम एक्सपोजर में हमारा कितना ज्यादा काम हो सकता है, उसी को बोलते हैं एज लो एज रीजनेबली अचीवेबल. ओके, सो दिस एग्जाम question has been asked again and again. Most of the time it has been Alara, but nowadays there is one more with the advent of CBCT. अब हमारे पास एक नई इमेजिंग मोडालिटी आ गई है जिसको हम बोलते हैं CBCT. ठीक है, तो ये जो CBCT है उसका क्या मकसद है? ठीक है, बेसिकली अगर आप CBCT और CT स्कैन को अगर आप कंपेयर करोगे तो एक तो एक्सपोजर टाइम ऑफ CBCT इज लेस देन 30 seconds, whereas if you compare it with CT scan, it depends on which part of the head and neck is being taken. Okay, since it is a cone beam, so in one rotation it captures everything. In CT it is created in a fan shaped, आपकी जो बीम है वो स्लाइसेस में लेती है आपके जो स्ट्रक्चर्स को. ओके, सो CBCT के लिए द न्यू थिंग दैट हैज बीन टेकन इज Alara. ओके, दैट is Alara, that is as low as diagnostically acceptable, as low as diagnostically acceptable. So as low as diagnostically acceptable is the new form of Alara. ठीक है, and made specially for CBCT, and this has been asked at least 2 times now in exams. Okay, so as Alara is important, Alara is more important nowadays from your exam point of view. Next, as low as reasonably achievable. तो किन like in what forms we want as low as reasonably achievable? The first is your time. The first is your time. Reduction of time of exposure can directly reduce exposure and radiation dose. So, reduction of time of exposure can directly reduce radiation exposure and reduce the radiation dose. तो अगर हम टाइम कम कर दें तो आपका डोज ऑटोमेटिकली कम हो जाएगा और एक्सपोजर भी आपका कम हो जाएगा. नेक्स्ट इज डिस्टेंस. सो डिस्टेंस का क्या है? एवरीवन नोज द इनवर्स स्क्वायर लॉ. इफ वी इंक्रीज द डिस्टेंस द इंटेंसिटी डिक्रीजेस. ओके, so by doubling the distance between your body and the source of radiation, it will cut the radiation exposure by a factor of 4, which is a lot. Okay, Next is shielding. Using the right kind of shield like lead aprons, thyroid collars, gonadal protection, all these shielding, it also helps in protection from the radiation. So lead or lead equivalent shielding for X-rays and gamma rays is an effective way to reduce radiation exposure. So how much amount of lead is more than enough to shield us from radiation exposure? It is 0.5 mm of lead is more than enough to shield us from radiation exposure. Okay. Next, what are the responsibilities of a licensed dentist and X-ray machine registrant? So do you think it is you just आपको बस एक क्लिनिक खोलना है, आपको उस क्लिनिक में बैठना है, आपने एक्सरे भी लगा लिया, सब कुछ लगा लिया, इज इट दैट इजी? नो. Whenever you are setting up a clinical practice and you are setting up an X-ray unit, be it a small IOPA X-ray wall mounted unit, you have to take the permission from AERB, that is Atomic Energy Regulatory Board. Atomic Energy Regulatory Board. Only then you will get a license to practice and take X-rays in your clinical setup. For CBCTs and OPGs, there are fixed dimensions that the room has to be of this square feet, then only you can take the permission. Plus, the walls should be lead lined, the glasses should be lead lined with 0.5 mm of lead. Okay. So this is like a small form which we need to fill to take the permission from AERB. Now, what are the radiation protection general requirements? Take all precautions necessary to provide reasonably adequate protection to the safety of individuals. Okay, we have to provide radiation protection to the radiation personnel as well as the patients that are walking into our clinic or the hospital setup. Unnecessary exposure कभी नहीं होना चाहिए. ओके, दैट इज वाई अगर आपने देखा होगा आपके HODs या आपके जो रेडियोलॉजिकल स्टाफ होता है वो कई बार गुस्सा हो जाते हैं व्हेन यू टेक द एक्सरे अगेन एंड अगेन, बिकॉज दे नो, आपको लगता है कि इट इज अ वेरी स्मॉल थिंग दैट वी आर रिपीटिंग द एक्सरेज अगेन एंड अगेन, बट नो, if we are using an alternating current X-ray machine, then the patient becomes highly susceptible to radiation exposure. Okay. Next, what is the maximum permissible dose equivalent? What is the meaning of maximum permissible dose equivalent? मतलब ICRP और NCRP के हिसाब से एक मैक्सिमम परमिसिबल डोज लिमिट है पर ईयर, पर 5 इयर्स और पर डे के, जो आपको फॉलो करना पड़ता है. सो राइट डाउन, होल बॉडी टोटल इफेक्टिव डोज इक्विवेलेंट इज 5 रेम और 0.055 सीवर्ट्स. 0.05 सीवर्ट्स. स्किन एंड एक्सट्रीमिटीज 50 रेम और 0.5 सीवर्ट्स. Lens of the eye 15 rem or 0.15 sieverts. Okay, so this is the maximum permissible dose equivalent. Next comes the collimating device. A collimating device plays a big role in radiation safety and protection. So we all know that there are 3 main types of three main types of collimating device that are used: circular, rectangular, and conical. Two most commonly used are circular and rectangular. If you compare circular and rectangular, which is better? Better is rectangular. Why? Because rectangular collimator reduces 60% of exposure parameters as compared to its round collimator counterpart. तो अगर अपन रेक्टेंगुलर कॉलीमेटर यूज करेंगे तो हम 60% तक एक्सपोजर पैरामीटर्स को कम कर सकते हैं व्हेन यू कंपेयर इट विथ राउंड कॉलीमेटर. ओके, I will show you how. If you see the rectangular collimator and if you see the round collimator, you can see in rectangular collimation when it is, when it is teamed up with F-speed or PSP films, the radiation exposure is effective dose in only 5 microsieverts. Full mouth X-rays with rectangular collimator and PSP or F-speed film is 35 microsieverts, whereas when you compare it with round collimation, full mouth X-rays, PSP or XF speed film, it is 171, and full mouth with D speed film is 388. So you can compare how much reduction in radiation exposure can be done if we use a rectangular collimator with a fast film. Clear? Okay. Same way, what are the exposure parameters when you subject the patient to various extraoral film sources? The first is panoramic, 26 microsieverts, cephalometric, 6 microsieverts, cone beam imaging, 76 microsieverts, computed tomography only for the head and neck, 2000 microsieverts. So you can imagine, if you compare between a CT scan and a cone beam computed tomography, you can imagine how much is the difference. Okay. Then plain skull films, around 70 microsieverts. Clear? Now the conversion table is important. This is a very dry topic. It is more like, what is there, it has to be replicated like that. Okay? So 1 gray equals to 100 rads, 1 rad equals to 1 milligray, 1 sievert equals to 1000 millisieverts and 10 lakh microsieverts, 1 sievert equals to 100 rem. So these four are the most important conversions that are important in our radiation safety and protection. Next is your dosimetry. So dosimetry में radiation quantities and units आती हैं. Exposure की SI unit है coulomb per kg, traditional unit है Rontgen. Absorbed dose का SI unit है Gray, traditional unit है Rad. Equivalent dose का SI unit है Sievert, traditional unit है Rem. Effective dose का फिर से SI unit है Sievert. There is no traditional unit for effective dose, and radioactivity का SI unit is Becquerel and traditional unit is Curie. So what we need to remember is exposure, absorbed dose, equivalent dose and effective dose. Okay? These SI units are more important than traditional units according to the exam. Okay? So whenever someone talks about what is the dose absorbed by the body, वो आपका सिंपल ग्रे में आप कर सकते हो. When someone asks about comparison between the different radiation exposure caused by different types of rays, ionizing, non-ionizing, then we talk about equivalent dose. When you talk about assessment of risk in an organ like gonads, thyroid, then we talk about effective dose. Okay. Clear? Then what are the regulations? Specify the minimum total filtration. Minimal total filtration का क्या मतलब है? Minimal total filtration का मतलब है कितना थिकनेस ऑफ एल्यूमिनियम डिस्क हमको लगेगी कितने केवीपी पर, ताकि हाफ वैल्यू लेयर निकल सके. हाफ वैल्यू लेयर का मतलब क्या होता है? द अमाउंट of aluminium required to reduce the incoming long wavelength photons into half. That is your half value layer. So below 50 kVp, 0.5 mm of aluminium disc is required. 50 to 70 kVp, 1.5 mm of aluminium disc is required. 70 kVp and above, 2.5 mm of aluminium disc is required. Okay, clear? Next is patient protection. So patient protection के लिए again there are lot of barriers. इसके ऊपर काफी visuals पूछे जाते हैं. So you can see this. This is, what is this? This is a lead apron and this is a lead shield. Lead shield is used by the operators to stand behind, so that they can stand behind them and make the exposure. Okay. वहीं पर lead apron जो है and lead shield दोनों में 0.5 mm of lead होता है. Next is this. What is this? This is not a sun hat that you wear in Goa. ये basically आपका thyroid collar है और इसके अंदर भी 0.5 mm of lead है. What is this? Again a big visual. This is a gonadal shield. Gonadal shield which also consists of 0.5 mm of lead. Now what are the responsibilities of us, the dental personnel or the radiographical personnel, towards the patients? First, patient should be protected from unnecessary radiation exposure. यूज एप्रोप्रिएट प्रोटेक्टिव डिवाइस, जो मैंने अभी आपको दिखाए. रेक्टेंगुलर कॉलिमेशन यूज करिए. फास्ट इमेज रिसेप्टर्स यूज करिए लाइक ई स्पीड और एफ स्पीड और इनसाइट फिल्म्स. देन आपके क्या यूज करना है? और वी नीड टू यूज डिजिटल एक्सरेज मोर नाउडेज देन द एनालॉग फिल्म्स, because it is estimated that digital radiography reduces patient radiation dose by 75%. Very important exam question. Compared with D-speed film, 50% when compared with E-speed film, and 40% when compared with F-speed film. Okay. Same, when we use intensifying screens, we reduce 55% of exposure parameters for radiation exposure. Okay, when we use intensifying screens. Why? Because intensifying screens are 50 to 60 times more sensitive to your radiation. 50 to 60 times more sensitive to your radiation. तो ये जो सारी चीजें मैं आपको बता रहा हूं, इसी के ऊपर आपका प्रिंसिपल्स ऑफ रेडिएशन सेफ्टी बेस्ड है. इसी पे आपके प्रिंसिपल्स ऑफ रेडिएशन सेफ्टी बेस्ड है. दैट इज ऑप्टिमाइजेशन, justification and dose limitation. Optimization, justification and dose limitation. Clear? Next. So, how using a fast film will reduce the radiation exposure? If you compare F speed film with E speed film and D speed film, they are all different. F and E are known as insight films, whereas D film is known as ultra speed film. So when you talk about F speed film, it requires 75% of exposure parameters of E speed film. मतलब 75% ऑफ एक्सपोजर में ही काम हो जाता है एफ स्पीड का, जो हमें ई स्पीड में 100% यूज करनी पड़ती है. सो व्हाट इज द टोटल रिडक्शन इन एक्सपोजर पैरामीटर्स? 25%. अगेन अ वेरी इंपॉर्टेंट एग्जाम क्वेश्चन. When you compare F speed film with D speed film, it only requires 40% of exposure of D speed film and total reduction of exposure is 60%. 60%. Clear? Next, we'll talk about radiation protection of our radiological personnel. तो वो किस किस तरीके से? बाय वेयरिंग डॉसीमीटर्स. तो हम डॉसीमीटर्स किस तरीके के यूज करते हैं? पॉकेट, फिल्म बैज एंड टीएलडी बैज, आउट ऑफ विच पॉकेट डॉसीमीटर, टीएलडी बैज आर मोर कॉमनली यूज्ड. ओके, so when we talk about pocket dosimeter, the most important question that arises is what is this pocket dosimeter made up of? The pocket dosimeter is made up of quartz. It is made up of quartz. Okay. How does it work? So basically आप इस तरीके से एक डॉसीमीटर होता है वो आप ऐसे लगा लेते हो, ठीक है. क्वार्ट्स की सुई एक जगह रहती है और जैसे ही आपका रेडिएशन एक्सपोजर चालू होता है, इट लीव्स इट्स पॉजिटिव पोटेंशियल एंड स्टार्ट मूविंग क्लॉकवाइज. ओके, इट स्टार्ट्स मूविंग क्लॉकवाइज. ठीक है, स्टार्ट्स मूविंग क्लॉकवाइज. और जितना ज्यादा सुई मूव करेगी उतना ज्यादा आपका क्या होगा? रेडिएशन एक्सपोजर पता लगेगा. Film badge is not used because film badge was very temporary kind of a thing. In that, what people used to do, take a plastic container, put an unexposed film in it. Exposure दिन भर क्वार्टरली चलता रहता था. 3 महीने बाद वो फिल्म निकाल कर देखते थे और देखते थे कितनी काली हुई है. उसके हिसाब से पता लगता था कि कितना ज्यादा काम उसके अंदर हुआ होगा या कितना ज्यादा रेडिएशन एक्सपोजर हुआ होगा. नेक्स्ट इज टीएलडी बैच. तो टीएलडी बैच में कुछ चीजें रहती हैं जो हमको याद रखनी है. आई एम नॉट गोइंग टू गो इनटू द प्रिंसिपल ऑफ हाउ इट वर्क्स. वी नीड टू रिमेंबर व्हाट आर दी materials that are used in TLD batch. So first material is lithium fluoride, which is most commonly used. And next one is calcium sulfate diphosphor, which is again very commonly used. Okay. Next, what else is used? A photomultiplier tube is used to check for how much radiation exposure a patient has gone through in a quarterly basis. Okay. So what are the 5 most important factors relating to the production of quality radiograph? Patient positioning and instruction पहले से ही सही होनी चाहिए. Alignment of the X-ray beam and the film. KVP MA settings जो होनी चाहिए, exposure time होना चाहिए, वो according to the subject होना चाहिए. Thin subject में low KVP और आपका thick या fat subject जिसका buccal pad of fat ज्यादा है उसमें high KVP. प्रॉपर फिल्म प्रोसेसिंग होनी चाहिए एंड यूज ऑफ रेक्टेंगुलर कॉलिमेटिंग डिवाइस विथ फास्ट फिल्म. ओके. प्रॉपर रिसेप्टर्स, एक्सरे रिसेप्टर्स शुड बी यूज्ड so that the patient positioning is comfortable. It is comfortable for the patients as well as it is comfortable for the dentist or the radiological personnel. Next, this is the maximum permissible dose for our radiation worker, for pregnant radiation worker and general public. So this will be the last topic that will be used. So radiation worker, traditional units 5 rem per year, SI units 50 millisieverts per year. Okay. Pregnant radiation worker 0.5 rem term, 5 millisieverts term. टर्म मतलब फुल टर्म की बात हो रही है, 9 months प्रेग्नेंट. ओके. जनरल पब्लिक ओनली 0.1 rem per year and 1 millisievert per year. Okay, so this is the maximum permissible dose. Then comes NCRP and ICRP के occupational dose limit. NCRP is National Council on Radiation Protection, that is our Indian एक संस्था है. ICRP is International Commission for Radiation Protection. Okay. Occupational dose limits are relative to stochastic and deterministic, and it is different for both NCRP and ICRP. NCRP के लिए stochastic में occupational dose limit 50 millisieverts and 10 millisieverts cumulative, एक साथ 10 millisieverts से ज्यादा नहीं दे सकते. वहीं ICRP को आप देखो तो 50 millisieverts annual effective dose limit और 100 millisieverts in 5 year cumulative, उससे ज्यादा नहीं दे सकते. फिर आते हैं अपने डिटर्मिनिस्टिक के हिसाब से. सो डिटर्मिनिस्टिक ICRP एंड NCRP दोनों का सेम है, दैट इज 150 millisieverts annual equivalent dose limit to lens of eye and 500 millisieverts annual equivalent dose limit to skin and extremities. Then comes patients के लिए non-occupational stochastic 5 millisieverts annual effective dose limit for infrequent exposure, 1 millisievert ICRP के हिसाब से annual effective dose limit, okay, not to exceed 1 MSV in 5 years. तो आप ये एक चीज अगर दोनों को कंपेयर करेंगे तो आप एक चीज पाएंगे कि कॉकेशियंस में जो थ्रेशोल्ड है वो कम है, हम लोगों का थ्रेशोल्ड ज्यादा है. बिकॉज थ्रेशोल्ड कॉकेशियंस का इसलिए कम है बिकॉज मेलानिन प्रोडक्शन जो है उनमें कम है। ओके, क्लियर? देन कम्स ऑर्गन और टिश्यू, ये इफेक्टिव डोज के ऊपर है। तो हमारे गोनाड्स रेड बोन मैरो का थ्रेशोल्ड कितना होता है? 0.5 रेम, दिस इज एन्युअली। देन स्किन, बोन एंड थायराइड का 3 रेम, अगेन एन्युअली। इससे ज्यादा नहीं होना चाहिए। ओके, सो एज यू कैन सी दैट it's a very small topic but very important one. Clear? So most of the topics I have tried to convert into a small precise one and hope this was helpful to you. Okay, thank you.